Welcome to this brief introduction to meningitis vaccination. We'll go over a brief overview of meningitis, risk factors for exposure, and vaccination for lab personnel. To start our presentation today, I wanted to talk a little bit very briefly about workplace mitigation tools for risk. This is in the specific example of laboratory-associated infection. This is typically a general biosafety plan to prevent any laboratory-acquired infections and how to deal with any risk exposures. We're going to focus today on vaccination, which is typically step number 1 in the prevention process for acquired infections in the laboratory space. But typically, a biosafety plan also includes safety training, competency assessments, risks assessments and mitigation tools, exposure assessments, incident reporting, intervention of the occupational health team for any exposures, and then a root cause analysis after an exposure is done. Let's focus on vaccination. We're going to talk today about meningitis vaccination. So let's talk about a brief overview of why this is important. Meningitis is a very severe infection. It is typically caused by the bacteria Neisseria meningitidis, and it causes a brain and spinal cord infection, typically in the brain itself. This infection can be very severe and include high fever, respiratory distress, seizures, and can be, in many cases, a fatal infection. What's also important to know is that to become infected with meningitis, you only need a very low infective dose of inoculation of this bacteria within your system. And unfortunately, it's also spread by inhalation of aerosols, which makes every component of meningitis infection very high risk for severe or fatal infection. This is why vaccination is so important. There are 3 types, generally, of meningitis vaccination. There's meningitis ACWY, which covers for 4 different strains of meningitis bacteria, and meningitis B. There is also a combination vaccine, meningitis ABCWY, which includes both types of vaccination. Let's talk about a typical schedule for meningitis vaccine. In childhood, we are most often routinely vaccinated against meningitis. A typical vaccination schedule that most people encounter in childhood is protection against meningitis strain ACWY, the first vaccine occurring between 11 and 12 years old, and then again at 16 years. If someone doesn't have this typical schedule, there are other schedules for catch-up, and then there's risk-based booster vaccination. If someone has a high risk of exposure to meningitis or they are immunocompromised, they might be eligible for risk-based booster vaccines every 5 years. We'll talk a little bit about what this means for lab personnel later in this presentation. There's also meningitis B vaccine, which is typically an optional vaccine, but almost everyone at some point during adolescence will fall into a high-risk category, and so meningitis B vaccine is pretty routinely offered. It's recommended ages 16 to 23 years old, but is ideal ages 16 through 18, because this is typically the age range where our risk factor will increase the most for exposure to meningitis B. Those at risk of outbreak include essentially anyone who lives in a group setting with lots of other people. This might be within a college dormitory, a military setting, incarceration, homeless shelters, etc. There's also those with higher health risks, people who might have complement deficiency, functional or true asplenia, as in people who have sickle cell disease, and HIV infection. Those people will also bleed into the category of increased risk populations for adults, who, as an adult, should then be vaccinated again or the first time for meningitis. Health risks, as we talked about, include complement deficiency, HIV infection, and functional or true asplenia when you don't have a spleen. They might also include travel or living in high-risk areas for meningitis infection. And then, what we're going to focus on today, occupational risk. Like we said, this might be people within the military, within college environments, But most importantly for today's topic, this includes microbiologists and lab personnel who are routinely exposed to the Neisseria meningitidis bacteria. So let's talk about that patient population. Special considerations for lab personnel. What makes someone high risk? Because there's lots of different people within the laboratory environment. Those at high risk are those who are dealing with this bacteria, those that make suspensions for gram staining on the benchtop, those who manipulate cultures of the Neisseria meningitidis, and those who have a compromised immune status at baseline. There are some populations that will be at lower risk, such as people who do not routinely work in the lab or just visit occasionally, and most importantly, those who are immunized, which is why routine vaccination for meningitis for our lab personnel is going to lower the risk of severe or fatal infection. Vaccination schedule and boosters for lab personnel include giving, initially, both types of meningitis vaccine, the 4-strain meningitis ACWY and meningitis B vaccine. Then, continued boosting and continued series is based on risk assessment. If risk continues to be high, such as people working in the laboratory with these specimens, then after 1 year after the initial meningitis vaccine, we boost again, and then every 2 to 3 years thereafter, if someone continues to be in a high-risk population. After the 4-strain meningitis ACW vaccine, we give 1 initially, and then we boost every 5 years. There are some precautions and contraindications to meningitis vaccine to be aware of. Precautions within certain patient populations should be a discussion between provider and patient on whether or not the risks outweigh the benefits of vaccination. Those patient populations might include if someone has a current, acute, moderate to severe illness with or without fever, we might defer vaccination until they are out of acute illness, and someone who is pregnant or breastfeeding, specifically for meningitis B vaccination. It's important to note that meningitis 4-strain ACWY is considered safe in pregnancy and breastfeeding patients. There are specific contraindications in which we would not administer a meningitis vaccine. Those include if someone has a severe allergic reaction, anaphylaxis, to any previous meningitis vaccination, or if they have anaphylaxis to any of the vaccine components. Otherwise, there are relatively few precautions or contraindications to meningitis vaccination. This concludes today's presentation. There are 2 references about laboratory safety and meningitis vaccine recommendations, both from the Centers for Disease Control and Prevention. Thank you.